Yes, welcome to the Design, Research and Innovation Festival 2020. Welcome to Drive Health. Yes, for the 7th year in a row, ClickNL and Design United bring you state-of-the-art knowledge and innovation. And this year, more than ever, we focus on social challenges. Health differences are a major problem. We all want to age in a healthy way, but there are huge differences because of our background and living environment, for instance. So how can we deal with that? How does a future healthcare system look like? And how do we involve citizens and other people? That's what we will discuss in today's Drive About Health. And we do that here live in the Effenaar with our audience sitting here, but also with the people back home with Zoom. Marjolein, you are our Zoom moderator. Yes. We already see that a lot of people checked in, and you also asked them some questions. First of all, who are they?
Well, I think most of them are creative professionals today, and we have some researchers, and we have a few people who are actually healthcare professionals. So that's very good to have them here. Welcome.
That's good to hear. And then maybe let's also see in our audience here, who of you is a researcher? Are there researchers? There are. And designers, of course. Do we have designers? And healthcare professionals. Do we have healthcare professionals in the audience? A little bit over there. Okay, great. Yes. And what about their involvement in healthcare, Marjolein?
Well, I'm quite surprised that there are some people who I asked them, are you involved in healthcare of the future? And a quarter of them says, not really.
Okay.
So I'm quite interested to see why they come to our Drive show online.
Yes. Maybe you can ask them that in the chat.
Yes, I will, definitely. Yes.
What are they looking for, or why did they actually checked in?
Yeah.
Yeah, nice to know. And if you want to comment something for the people who are watching back home, please join us in the discussion. You can ask your question to Marjolein, or you can be live in the show as well. So whatever you want to know, tell us. Because we are going to start with the program, what is actually happening in the world of design. We are very happy with our first speaker, Jos Stuyfzand. He's Senior Experience Director at Philips Experience Design, and he will talk about co-creating tomorrow's hospital today.
Oh, sorry. If you want to go fast, go alone. If you want to go far, go together. How far do we need to go to change our healthcare system, to fulfill the short-term needs? And how do we make it sustainable on the longer term? How fast do we need to go with the relentless COVID-19 virus racing over the world, affecting our daily life today? What is the best approach? Is it top-down, waiting for the vaccines, waiting for the measurement of Mr. Rutte, or if you're not a country, in your country, or bottom-up, creating a responsible and caring society? What we have learned over the last 9 months, it's a mix of that. It's a mix that comes together. One thing is for sure, we need to go together. If you talk about the transformations in healthcare, I like to talk about journeys. Journeys of explorations, getting insights, but also to learn on the job, because it's not a system change, it's more a cultural change. A cultural change with failures, but also celebrate successes. And that's exactly what co-create is for me. I first want to share with you a vision that we created, and that gives a good insight in the challenges we have in the future.
Today we see a continuing and concerning trend of cities building more and more hospitals to meet the demand of their growing population. This may solve the problem for now, but it is incredibly expensive and not at all sustainable for the long haul. So think about this. In 2030, healthcare is decentralized. Hospitals will only consist of crucial elements that require patients to be on site. All other functions will be redistributed and made entirely mobile in a network of hyper-connected autonomous vehicles. So instead of you going to the hospital, how about the hospital going to you? In a future with autonomous healthcare, what else would you like to see?
If you talk about the challenges and changing the healthcare system, actually it's really a big challenge. It's not coming from the healthcare providers in the future alone, or tech companies like Philips. We all should be involved. It should be very inclusive. And that's why Sean Carney, at the start of the Dutch Design Week this week, in his keynote, had a call for actions for us as designers. We must design with new purpose and urgency to ultimately improve the world. And let's make the world a little bit smaller today to focus on healthcare. He also suggested 3 approaches. One is the empathic approach, really stepping into the shoes of the patients, the family, and also the staff, which is so much under pressure. Not jumping too quickly to solutions and start to fall in love with your own ideas. Really understand it. The second one is the systemic approach, not looking at the single problem, but at the ecosystem of care. And the third one is to partner, bring in new partners, really to create a sustainable care system. I have some nice examples of that. To start with the empathic part. At this moment in time, we're doing a lot of workshops, and we're all very familiar, because you're all professionals, we're very familiar with that. Also in Philips, from the board of management up to the operational departments, we co-create like hell. But it's with the experts and specialized people that really have a focus there. I also prefer to go there, and I was a couple of weeks ago, I was at an emergency department in Germany and really experiences for a couple of days what's happening there on this emergency department. And that really empathic insights that you get there are very inspiring and also should drive the co-create processes. So co-create is great with the experts, but make sure that you grab also the insights on the floor and find the right balance of that. If you look at the process, it is actually, this should be animated as well, but it's a very simple process. The first step that you take, you discover, you get your insights. The second one is that you frame the challenge. What problem are you going to solve? Then the ideation, getting your ideas, and then build, prototype, and test. However, for healthcare, it's a little bit more complicated. For healthcare, we need to include the patient pathways or the patient journey, the enabling processes. We need to look at the empathic part, the social part. What is the context of the patient, the family, but also the staff, how they really can improve the quality of life there. There's also technology, of course, and there's the environment. And it's a very iterative process there, what really is the complexity of it. If you talk about changes in healthcare, we very much focus on hospitals. But I always say, let's start with the narrative, with the storytelling. What is the new story of the care that you want to provide, the care service? And then see what kind of environment supports that. You probably will find out that most of the care can be provided in the future outside the hospital. And that was also part of that vision, that movie, that the hospital will shrink to a very high specialized place, networked with even mobile units, but also medical care centers in the future. Talking about the systemic approach. The systemic approach has some nice examples, and they're very different. For me, the journey started with ambient experience, where we put light, imaging, sound in environments to improve the patient experience, but also to improve throughput. With amazing results, we have more than 2,000 of these installations installed in the meantime, and the 70% less retakes, meaning that you have one take first time right, which is good for the patient and good for the hospital. Secondly, 90% improvement patient comfort, but that's only one room. And that's where the journey started more than 10 years ago. Now we're facing fantastic, intriguing challenges, I must say. In Russia, 71 clinics, date from the 50s, 60s. It's really a heritage. They need to speed up. There's an increasing demand. They need to be refurbished. They ask us to help them. And what we did is to start to transform them. You see on the left side the actual situation, and the new situation that we create. We templated the rooms to bring in elements of comfort, healing environments, to safe workflow principles, but also really comfort for the patient. It's quite an amazing journey, because the reality of Russia is that people stay much longer in the hospitals, much longer than in the Netherlands, for instance. And we learn a lot from them, what their cultural preferences are, and they learn from us what about healing environments in these environments. It's really an amazing journey. The other one is about the partner approach, and that was also a specific engagement we had with the US Department of Veterans Affairs. They ask actually for a telehealth system to connect, let's say, the veteran people, their members, and then 9 million of them, and 3 million of living very remotely in rural areas. And they far away from the care points. So we went there to the rural areas to really understand their needs. We co-created with them, talking about experiences. What are their needs? What do they understand? And how to communicate with them. And that resulted into a hub that we created for them. And that's in the meantime already installed. We have 10 pilot sites there where they really are connected from their veteran clubhouse, so to say, that they have locally, because that's more their living room where they go all together. And they can also be connected with the care providers of the Veteran Affairs. After the pilot, if it's successful, we can roll this out. And it's really in line with our mission within Philips to really listen carefully to people, understand their needs, coming up with connected care solutions and giving expand access to care for 400 million people in the near future. That brings me to my last statement. My last statement is about what is the healthcare transformation about? Yes, there is the scientific part of it, there is the technology part of it, but it's more a cultural change. And it really needs a holistic approach. And the realities, as you probably have noticed already with my examples, are very different. And they're very different cultural preferences. So there's not one system fits all. It's not a system, it's a cultural change again. In Philips, we use the quadruple aim, trying to improve the patient experience, the staff experience, but also the clinical outcomes, of course, and last but not least, lower cost of care. Care needs to be affordable for a lot of people. Co-creation is a very powerful instrument in the collaborative visioning and development of the new ecosystem of care. We as designers are in unique positions. We are in boardrooms and we are on the floor where the real experiences are. With that unique experience, we can bring people together and collaborate and co-create, and also come up with solutions and ideas. But at the same time, take ownership and responsibility for these ideas by prototyping, testing, and learning. If we do that, we can be really important catalysts in the transformation of the care ecosystem. Thank you very much.
Thank you very much. Jos, join me here at the table for some questions. Marjolein, are there already some questions from our people watching back home?
I think people just finished listening to Jos and are thinking of some questions right now.
Okay,
so we'll come back to them later.
Great, thanks. Yeah, because Jos, you're talking about that cultural change instead of a systemic change. It's also necessary, but that culture change is important. Do you have a question over there? Oh, you do? Okay, well, let me first finish. No, let me go to you first. Sven is coming with the microphone. And tell us who you are, please.
Hello, my name is Jeroen van Erp. I'm one of the founders of Fabriek Design Agency, but also a professor at Delft University. You say you're looking from a holistic point of view, but at the same time, I miss some vital players in this whole system. So do you also involve the insurance companies, for instance?
Yes, we do.
Okay.
And there are a lot of, if I talk about the partnership, I showed this Veteran Affairs example. That's
yes.
also a separate organization. But of course, we sit together with all the stakeholders involved to reach the goals in healthcare. You cannot do without them. And they are, in the Netherlands, a very important partner, for instance, to transform the healthcare system.
Okay, and are you also aiming to change the organizations? Because I think there is a big opportunity to completely change the organization of a hospital, which will benefit healthcare in general, because I think the system is really has a lot of lock-ins, like the way the surgeons are organized and so on. Are you also dealing with this, or because I think we as a designer also aim for designing the perfect solution while the problem is somewhere else?
Yeah, well, I'm very happy with your question, because we are also sitting together with the board of management as well to see, okay, what's the long-term change that needs to be achieved? And there's urgency. It's not only because of COVID that we need to change the system, but we're also on the floor start to understand what's the actual situation. You cannot only do a top-down vision. You really need to learn where you are. I always say, if you want to go to Sydney, you need to know if you're in Amsterdam or in Singapore, because that defines your journey. And that's what we try to do, to balance that in workshops and other engagements.
Okay, and I was also surprised by looking at your wheel that you want to maximize revenues and reduce costs. Isn't that a problem in itself for how this whole system is organized?
There's not one system in the world. There are private systems, there are public systems, and the approach is different. But healthcare can only be sustainable at least if you have a break-even, or you can manage the cost, or when you're a commercial company, you have to have revenues and profit. So both systems are in the world. You see much more a mix in the future. There are some part of the care, for instance, other companies are taking care of that. So it's not primarily making profit, but it's really get a sustainable system. And let's say getting revenues or break even or making profit is part of that sustainability in healthcare in the world.
Because thank you for your question. You got so many. Because he's stressing the very complicated situation of healthcare, changing the healthcare systems. Because how do you deal with that complexity? Because if you really want to change something, you have to change the whole system, and that's full of interest, full of stakeholders. So how do you deal with that as a designer?
Well, designers are T people, so they know T people, meaning they know a little bit of a lot, and when they have a project, they really go deep, And that's actually what you do, and that's also why we are less hesitant to connect things that other people don't connect. I was talking about the patient pathways, the technologies, the enabling processes. We can make these connections there to come up with a solution. That's typically what designers do. That's in our nature, to connect things and to come up with solutions. The 1 and 1 is 3 solution. That's typically what we do. And co-creating is the formal process, going through these steps, to achieve that.
But are there also boundaries then, because it's such a complicated problem that you also need sociologists probably, you need people who understand the politics, you need people. So is your team well enough equipped to really make that change?
Yeah, it's not only designers. That's designers mainly have the role to connect, but the specialists. And we have clinicians, we have business analysts, we have technicians, everybody and they need to be in the room to create a solution. So we have more a facilitating role. However, we can bring it together, synthesize, and also prototype it, really create a desirable world, to see that it works. But we are a servant in this, but we need to take ownership also of the process, of course, sometimes. But it's mindset over process. It's more about see what you want to achieve together, than following the process. But you need to trust the process sometimes to achieve something. But it is typically what we do as design at this moment in a large scale, especially in Philips, from board of management up to the operational levels.
So let's go back to your idea of actually creating smaller hospitals and making care also more of the neighborhood, of a cultural product. Because what is needed to make that mind shift as well?
A lot needs to change. Sometimes it happens in a natural way. For instance, in Japan, they have a rapidly growing population, and they all live remotely. If you build hospitals in the city center, that was the movie about, then you miss. It's not sustainable. So you need to move mobile. You need to bring it to the community. So that's an immediate demand. And there are more parts in the world where people really don't have access to healthcare. So that's one. If in let's say, most of the Western world, or let's say in the Netherlands, where we have a lot of care, we need to see how we can reuse more efficiently. And do you really need to go to the hospital? There are also scenarios, how can you bring the care at home And there will be new providers. There will be people. You have also the 360 view on the patient, not only as a patient, but the social environment and also even their economic environment to understand that better. And then you can really take care of the patient. It's not only a medical
So
challenge.
you're creating better care.
Yeah.
It's less expensive if you bring the care really to the people. But the hospitals, they have an interest in actually getting those beds filled.
Yeah, but I think the bed towers they will disappear more and more. So the last big hospital is built in I think it's Erasmus in the Netherlands. The next one will be smaller. Although now with COVID, the situation completely different and very disruptive. Yeah, you need beds, you need people in there, you need staff. It's a tremendous challenge.
But they're also now creating more like hotel
Exactly.
hospitals
So
for
you need
COVID patients.
You need to look for different formats, like where you benefit from the hospitality. How can you do that, but still assure a certain safety in these rooms? It's cohort management. You're putting people that are infected, non-infected, not bring them together. It's a completely different logistics, I would say, even because the scale is huge. So we have these in-between formats, and you see this happening all over the world. That you had these hotels are refurbished to really host patients, so they
Yes.
can take care
But
of
so
them.
it's not only a matter of costs, but it's also actually absolutely better for our health.
It's better for our health, but you need to realize that a hospital is in principle geared for the medical care, which is the most cost-intensive environment you can imagine. So at the moment you need less care, you need to offload the hospital as much as possible and to see how you can find solutions closer to the home. Also that the community can take care of the patient, the relatives.
Because it will improve my healing process.
Definitely. Yeah, the healing actually always starts at home, not in the hospital. At least it's not an ideal environment. I know everybody's working hard to do that, but we're finding other ways. And technology is enabling that. With the digital connection, you get the data, you can easily exchange between the expert centers, the specialist centers, and the home, and you can monitor people 24 hours, 7 days a week.
Yeah.
If I may
Marjolein, yes,
interrupt, yes, I have a Zoom person
live.
from
Great.
the audience back home with a question which is very much into what you talked about.
Okay, wow. Okay, well, welcome in the show. Tell us your name, please. You're live now.
Hi, I'm Muka. I'm working as a researcher at the LVG West Hospital. And I have a designer background. I'm an industrial designer. So I was wondering how we should envision the new healthcare system. So if we move the care to our homes, is that completely possible? And what are the greatest challenges?
Yes, so is it possible, and what are the greatest challenges?
That's a big question, actually.
Yeah, it is.
Thank you for that. The greatest challenge is probably the risk management, that you make sure that is the patient at risk or not, and the monitoring of that, and that you are preventive, that you anticipate actually the condition. That if patient comes too late, also that's the big challenge now with the elective care that's now postponed, that people come too late in hospital,
Yes.
and that will be the big challenge. How can we stay in contact with chronic patients, that we can monitor them, so we can be there in time and provide the care at home.
And is it also a desire of the patient himself? Because I can imagine that patients, that they want to be in the hospital,
sure,
they feel more safe in the hospital.
Yeah, but they also want to manage their own life. You don't want to put it in the hands of your doctor. Although I must say in the world that can be different. I give the Russian example that people have a different relationship with their doctors. So basically you want to empower the patient more and also their relatives, because they need to support them in their healing process as well. So that's something that you need to take into account. That's why it's more about the discussion, the whole ecosystem, than just managing the disease.
And are you taking that perspective of the individual patient? Do you take it enough in account?
Very close to skin. Of course, you need to represent. We do a lot of research in the market, really talking to real patients, and try to create these what they call personas to make a collective individual, let's say, to represent the patient population.
Yeah.
Yeah, and that's important, and you need to bring that into your process. Also, even with doctors and with care organizations, so everybody's looking at the same person and try to solve the problem in a very holistic way. Yeah.
So our Zoomer, are you still with us? Because you had a second question as well. The first one was the biggest challenge.
Yeah. Do you hear me?
Yes, we hear you.
Yes. So, what are the greatest challenges? That was my first question. And how should we envision this? Because if we monitor the patients from a distance, like use wearables or other telemonitoring devices, there will be a lot of data. And who controls that data? And what should we do to take control? Have control on the patients.
Yeah.
Well, one of the very important tools, I think, is the narrative, to create this narrative. First, tell the story, what's happening, and then see what kind of solutions are needed to support that. Sometimes we look at solutions and try to solve the problem, but you first need to understand what is the total context of that solution and where is it effective and where not. For instance, monitoring, is it at home, is it in the hospital, how do you connect these things? You really need to look at the total care pathway.
Yeah. But that was also his question, how can you envision it? How can you really make people warm for this idea?
By literally making sometimes cartoon as designers. So everybody can understand, okay, this is the story, this is we need to support there. And so it's a very relatively simple language, and then you can do a deep dive in the clinical process, you can look at technologies, but everybody has an understanding what needs to be achieved. It's the storytelling, literally the storyboard is one of the tools that we use a lot. Yeah.
Okay, are you happy enough with the answer?
Yes, thank you.
Okay, great. Is there also another question, Marjolein?
We do have another question, yes. I'm not sure who is pinned at the moment, because there are so many questions streaming in, so we have to make choices and act quickly.
Do we have someone live?
Do we have someone live, technical staff? Yes?
Yes,
Let's
we do.
go. There we go.
Well, welcome to the show.
Okay. My name is Peter Blankenstein. I'm a medical specialist in the University Medical Center in Utrecht. We as a society have great and important objectives in transforming the society to a more sustainable one. To what extent is reducing the environmental impact of healthcare also a specific aim of your company?
Reducing, you said. Yeah.
Reducing, yes.
So you mean more the environmental aspects, how that's connected to health and?
Well, for instance, in the Netherlands, the carbon footprint of the Dutch healthcare system produces about 7% of the national carbon footprint. So if you realize that that has to be reduced by 50% in 10 years, that's an enormous task.
Great question. Yeah.
It's indeed a great question, and there are two ways we approach that. Philips as a company is also has a very strong sustainability policy and wants to be carbon neutral. I thought it was 2030 already. So that's an ambition. When we deliver something, put something in the market, to take it back and make it carbon neutral. That's a big commitment we already made. Next to that, we also now in discussion to finding the ecosystem about sustainable healthcare. If you look at healthcare as an entity, where is there waste and how can you manage that? We're not there yet. We have the first ideas there and we discussing that. By the way, there's not Philips only doing that. We do this together with the customers because you need to find partners.
Yes.
We cannot say, okay, this is the way you can be sustainable. It's more, let's sit together. Where is your waste? There's so many aspects, so many streams in the hospital that produce, let's say, that use energy and waste, that how can you combine them? How can you also change your way of working?
So it has your attention, it has the attention of
Absolutely,
Philips.
yeah.
Is that an answer to your question?
Well, to a certain level, of course, but I think you can position it even as a higher priority.
So that would be your recommendation to Philips?
Yes.
Yeah. Okay. Well, I'm very happy to take it with me back to Philips, first of all. But I do think, and it takes more time, but we do think for all kind of aspects, We're a very sustainable company, and that's recognized from the outside world at this moment. And this naturally belongs to that. There's also a societal responsibility you need to take as a company.
Yeah.
But again, we need to do it together. Also, the hospitals we need to sit together.
Yes, you really need that collaboration on this topic with all the stakeholders. Well, thank you for your question. Let's go to the last question, Marjolein.
Oh, no, sorry. We are out of time. I got from the technology.
Oh, we are out of time. Oh, we are out of time. Well, okay. Well, then, Jos, thank you very much for your inspiring story. A lot of questions, but not a lot of time. So give him a hand, Jos Stuyfzand. Thank you. Because we move on to our second theme, what's happening now in the world of research. And I'm going to talk about that with Sabine Wildevuur, Director of Design Lab, University Twente, and Rúben Gouveia, also from University Twente. Welcome. Sabine, welcome at Drive 2020, and also Rúben Gouveia, also welcome. You're with us by Zoom. Welcome in the show as well. Let me first start with you, Sabine, because you're conducting an inventory research for the 4TU Federation, the 4 technical universities in Holland, on the potential of citizen science. Well, first of all, what is citizen science?
Well, citizen science is a very broad term. Kind of umbrella term, and there are a lot of definitions. What I like to refer to are the 10 principles. If you Google it online, the European Citizen Science Association, you will find them. But for us, the main thing is to combine the top-down approach from academia with the bottom-up approach when you start with societal challenges.
Yes, so listening actually to the patients, listening to the users.
Yeah, there are different steps in citizen science, and it depends also in which domain. Health is a different domain than citizen science for other domains. But what you try to do is already start with co-creating the research question, but then try to involve the citizens, the patients, or others in the different step of the research process. And I can show you on one slide, like here. And so it's not one thing. As I said, it varies, it differs among the different domains it's applied to. But what you see in citizen science for health, that it's underexposed to research compared to other domains. So there's still a lot of work to be done in that area. And what you also see that in health, what we heard from the previous speaker as well, is that you involve the users, you involve patients, healthcare professional, insurance companies, all of them. But the patient is not that much involved in the research on in citizen science yet.
Yeah, that's
so
what we know.
So there's a lot that we can still look into and have this patient really involved.
Yeah, because what is the goal of your inventory? Why are you doing that? What are you aiming for?
Well, maybe, and go back to another slide. This was a workshop that we held, and again, what you see here, and this was an interactive poll that we held during the conference of the European Citizen Science Association, and this was a workshop specially on citizen science for health. The experts there in the group were also experts in citizen science for health. And what you see, we asked them to plot their project on a framework, and the framework is on one axis, you see the researcher-driven projects, and on the other end, the more citizens or patient-driven one. And we have the other axis, and the results serve a more generic purpose or an individual purpose. And most of the people there plotted their research in the upper right-hand corner, meaning it's researcher-driven and serving a generic purpose. And so the citizen-driven part is left out, and that is what we see. So with the research that we are doing is, and this is also an open call to all the 4TUs, but everybody who is active in this field, to share with us, and please contact me, to share with us like what is already happening in the field of citizen science to design for health.
Yes, so all the initiatives, all the research that are actually done or will be done, please tell.
So we are now making an analysis of the projects that are going on at the 4TUs. And
because do you have a good example of citizens?
Yeah, it's
research?
always difficult to start with a good example because there's so many. And of course, if I would be egoistic, I would refer to the Citizen Lab that we are running in the region of Twente, which is a great one. But I think the principle perhaps is shown with this picture. And this is Rúben. Probably some people already know him. He started in Reda Diabetics. He was diagnosed with type 1 diabetes himself when he was around 30. And it's a big hassle. I mean, for us, it's not so clear what happens if you have diabetes 1, but it's really, yeah, your whole life is upside down. And he said, why can't I design the pancreas, which is not working properly with those patients, into an artificial pancreas?
Yes.
He started it himself. He has a more technical background, and he got all the people involved. So the research question he started with himself.
Yeah, so really, this is
yeah,
really
but
a bottom
most
up.
people said that he was completely crazy.
Yeah, but he actually continued, and now
He continued, and he just got the CE certification. So he was on the news as well, like 2 weeks ago. He's going to start, he was his own guinea pig as well. So he built this artificial pancreas. He is wearing it. I talked to several patients who were also a guinea pig, and they said, we feel completely different.
Yeah.
So what happened here was that he started a bit like with the research question, but he also said that academia sometimes is really slow. He cannot wait for all this research to take place. But of course, you also want to make sure that it's really fundamental looked into as well. So how can you combine
all
these
those
pathways?
criteria?
Yeah, and I think he is there. He was the icon for innovation in the Netherlands. So he's just doing what he needs to do. But that is really a start where you start with the patient, and he wants to solve it. And other people say, no, we have to go that direction. He say, no, for my disease, this is the way I need to do it.
So it's a great example, this man. Actually, there is also another research going on, Rúben, because you are working on research pride and prejudice. What can we do to prevent chronic diseases? So what can we do to prevent chronic diseases?
I think that there's a lot that we can do. What we try to do within Pride and Prejudice is actually build tools that empower people actually to make healthier decisions in their daily lives. And we already see a lot of these tools in our daily lives. We see tools from wearables. We have our phones, for instance, nowadays that already track our behaviors to try to make us make healthier decisions. But we do see that a lot of these tools are abandoned within early weeks or even early months of usage. And it's not necessarily because they help people up to an extent that they don't use them anymore. It's actually because in some cases they actually develop negative feelings. And one thing that we try to do within Pride and Prejudice is actually bring together, I think, around 50 researchers with different backgrounds and expertises, from engineers that have expertise in consumer behavior to interaction designers with expertise in behavior change, to really look at how we can design tools that actually help people make healthier decisions in their daily lives.
Yeah, so we are very curious about those tools. So what can you tell us about those tools? What can we use, or what can those people use?
So maybe I could refer back to the name of the project just to start this conversation. So the Pride and Prejudice, it was actually inspired by a novel that was written in 1812 from an author called Jane Austen. And the main story is this love story, which is very complicated, between an aristocratic rich man in a high society family and a woman that was from middle class. And it really shows how their relationship was really affected by prejudices. So how this family of this rich man was really against this marriage because the woman was from a lower social status. And what we see is that these prejudices are also associated to healthy lifestyles. So for instance, not everyone is really able to maintain a healthy lifestyle, especially people that have, for instance, underlying health issues. And these people really face these prejudices and are stigmatized in society. So what we try to do in Pride and Prejudice is create tools that actually make people proud about the first steps that they are taking in changing their lifestyles. And one thing that we try to do, and I think connects quite well to what Sabine was mentioning, is actually involve them in this process of creating these devices themselves and making them feel proud that they are actually contributing not only to a change in their behaviors, but maybe something that is contributing to a larger societal issue. So one classical example that I normally give is these wearables that we have that try to push us to walk a certain number of steps every day. Sometimes they're quite misadjusted with what people are really able to do and their own interests. So what we try to do is really involve people in thinking about what they want for themselves, trying to set goals for themselves. So really trying to engage people within this process.
Okay, so make them pride about their first steps, actually, for reaching that higher goal. And I'm still actually looking or thinking. So, what is then the contribution of designers in this research field? Because it sounds more like a psychological thing.
I think there's a lot of contributions that designers can bring to the table. First of all, thinking of what strategies, for instance, these tools are using. So normally as designers, we tend to implement certain strategies to try to motivate people towards a certain behavior. So these are decisions that are made not only by designers, but of course by psychologists, by a big team of people. And as designers, we can actually think about the processes that we make in terms of choosing these strategies and implementing them in tools, with, of course, collaboration of other people like psychologists.
Okay, great. Let's see if there are some questions from the people. Let's first start with the audience here at the Effenaar. No questions? No questions? No. Marjolein, are there questions?
No, again, I think people need to take some time to think of questions. But I actually do have a question myself, Rúben, for you. I have one of those gadgets, like my stappenteller, and I'm always like, but how does this device know that I need 10,000 steps? Why would that be for me? I mean, that might be for as a mean, but not an individual approach at all.
I think that this 10,000 step number was actually based on an article that was written quite some years ago, and in a way it seems like the easy solution. Let's try to push people to walk these 10,000 steps. And there are questions towards if this is what people should actually be doing. And we see that often these 10,000 steps are quite misaligned with what people are able to do or what people are even interested in doing. So not everyone is able to walk these 10,000 steps every day. And there was a study that I conducted a couple of years ago in which I saw that a lot of people actually do not achieve these 10,000 steps. But they still stick to these 10,000 steps, even though they're not achieving it. And this has quite some detrimental issues. So people actually abandon these tools. They feel that they're very confrontational. So there are certainly steps that need to be taken into having people think about what they want in terms of these goals for themselves.
Well, because do you also have more, or maybe also, Sabine, do you have more examples how to really involve people in their own health issues?
Yeah,
so we have that watch, but what kind of tools are there?
There are a lot of tools. I think but the starting point is what do we like to solve, and that's again with the research we are doing is first looking what is already out there, and then see in my case like how is citizen science being applied. And what are the methods being used, and then see where are the research gaps. But I think there's already a lot where we can measure, of course. So it's not in the technology we're using, but it's going back to the research question, like how can we support people also through technology to live a more healthier life, or to support them in the illnesses they have.
Yeah, so first we start with that question. And Rúben, do you have some more concrete examples or tools? What will work or what can work?
Maybe one example that we developed within the Pride and Prejudice project, which I think is also a nice example of how this connects to the different researchers that we have, was an interactive dining table that was developed by a group of researchers at the University of Twente. So this was a table that had over 200 sensors, so it could measure, for instance, the weight of the food that people have on their plates, the transition of the food across the table. And it also had LED, so besides measuring people's behaviors, it could actually give feedback to people based on however they are acting. So we then combined this with people with expertises, for instance, in food and nutrition, to actually think about what feedback we want to give to people and how we can efficiently give this feedback to people while they're at the dining table, which is a very social action. So these are some tools that we are starting to build.
So how does that table look like? You're sitting on a table eating, and then the table is actually communicating with you?
It's a round table, actually, so it fits around 4 people, and it communicates through LED. So this is very abstract visualizations. Of course, we don't want to be too confrontational in these settings, but we want to be able to give feedback to people. So it gives feedback to people through lights right now.
And then what do you hear?
No, you can see different lights. You can
lights.
Yeah. So we can have... maybe we could even have people creating their own patterns of lights depending on the feedback that they want to see for themselves. We have a lot of possibilities that we can explore within this table. So we can already sense a lot of behaviors. Now it's, of course, figuring out what to show to people in an efficient way.
Okay, because is there one, could you say there is one tip or there is one key element that you always have to bring in if you want to motivate people?
I think involving people in thinking about what they want from these devices is an important first step. So trying to think about the goals that they want and how they can address these goals within these tools is an important first step. That's one thing that I would say.
Yes, and then we are back
and the value for people as well. What does it mean for the users? And then how to involve them in that process.
Yes, and then you really got that custom-made profile, actually.
Yeah, and we heard it by the previous speaker as well. It's in all the different phases, so it's not that there's one recipe. There are different recipes, there are different methods to get to the where you want to be in the end.
Yes.
So,
and do we have enough time, actually, to make that unique profile of everyone?
Well, I think, is there enough time? We don't know, because we have seen with COVID how fast things are changing. And it is a good example how things have been changing for Design for Health. I mean, we couldn't have predicted last year because the table was shown here last year during the Dutch Design Week. And we couldn't have imagined then where we would be now. So, and if you look at a lot of stuff also in the field of healthcare, the whole e-health has changed very rapidly and was introduced in a very speedy way. So I think, is there enough time? Well, we see that we can speed up if we need to.
Yeah, because now we also see that we have a lot of general measures, for example, to actually deal with the COVID pandemic, but not very individual measures.
Well, there are a lot of data is being collected, of course, and that was also with the previous speakers, but that's another topic in a way. But I think it needs all to be in an open, science needs to be opened up a bit as well, and also the data. So you look to fair data, which is findable, accessible, interoperable, and reusable. So if you go with those principles, then this data that is being collected could have been used. And that's quite difficult because the system is now that we keep the data in certain silos. It's difficult to open it up. It also has to do with ethical and legal issues. But that's also one part of the next steps, and also in citizen science. How do we open that up?
Yeah, and that's also part of your research.
Yeah, that will be part of the research. We will present the research middle of December, and to see where are the research gaps. But these are definitely topics that we will look into, and also see what is happening already at the moment.
Okay, let's go to a question from Daan. 2 questions, Daan and Bart, here live at the Effenaar. Sven is going to run. Are there also questions, Marjolein, from people, from the Zoomers?
I do have a question, yes. I think this one is for both of you, Rúben and Sabine. Bariatric patients change their lifestyle after surgery. But how can we motivate them for a longer period to commit to changes? That's a big one, I think.
Okay, so more the durable change.
Yes.
Rúben?
I think, and connecting to this point of helping people understand their goals, I think another thing that we need to keep in mind is that people's goals evolve over time. They're not static. And I think one thing that we need to do is really thinking about tools, really building tools that help people periodically reflect on changes to their goals and what they want for themselves over time, because these things are not static. They don't keep the same goals over a lifetime.
Yeah.
So I think that is an important step to think about.
Okay, so make those goals clear all the time and also when they change.
Yes.
And make flexible technology so they can adapt to those changes of the users as well.
Okay, great, yeah. Daan from de FNR, here live.
My name is Daan van Eyck. I'm co-director of Design United. It's the 4TU Research Center. Of course, we are connected to this project, but on the other hand, I know there's a lot of researchers there from the different universities and, of course, also other parties. So can you tell a little bit, briefly, of course, what are other research is going on in the coming, let's say, 2 years in this project?
You mean with the citizen science?
Yeah, maybe connected, but also in the Pride and Prejudice itself.
Yeah, I think, well, it's a work in progress. And if you listen to the project of Rúben as well and the Pride and Prejudice, I think it's very important that we build upon the knowledge that is now being created. And that means, and we heard it by the previous speaker, we need to do it together. And so I think that's the main message, and it sounds quite obvious, but there's still a lot to be learned in that sense. So I think for the coming and after 2 years, where of course we want to be, is that citizen science for health or citizen science to design for health, that we dived into it, but that we also conducted the research that is linked to it. Because now, as I said, it's underexposed, citizen science for health. A lot needs to be done. Research is most of the time a bit slower than if you look at design and what we do. So how can we balance it, but how can we bring that together? Because a lot are working now on societal challenges. We heard it during the whole Dutch Design Week as well. And so that is the next step to take. And also from kind of engaging people and engaging citizens to really involving them, which means that you are then in citizen science. I don't know if it's an answer to your question, but and what we're doing now, and we see that a lot is out there, not everything is named or framed citizen science, sometimes because people don't want it to be phrased like that. But I think now there seems to be a momentum where there is a drive, really a drive.
Yeah, but a willingness to...
to develop this in
co-creation, actually.
Yeah. Well, there's no citizen science without co-creation. So everything we have been doing so far in design for health, and it's a grown-up field now, and now it's the next era in a way.
So that's also your call. So please tell me what's going on. Yeah. Let's join together. Let's collaborate on this topic.
Yeah, and these examples as Pride and Prejudice are of course great ones, but some of them we probably are not even aware of.
No.
So
okay, let's move on very quickly for the last minute to Bart before the break. The mic is coming.
Yes. Thanks a lot, Sabine, and about this topic. At the risk of bringing up a new discussion, but I think there's enough citizen science in life sciences and health going on, but I dare to say that we are in the risk of losing the connection to what's already out there. If you look at the agenda of the other top sector, my colleagues of the life sciences and health top sector, their agenda and the huge amount of research that is going on in there, the field labs that they are creating, the citizen participation projects that are going on all throughout the Netherlands.
So what is needed then? Because there is enough research, you're saying?
I think there is so much going on, and the challenge is for design to find the connection.
Okay, so that's a challenge, to find the connection.
Yeah, that's, I think, is the biggest challenge at this moment.
Okay, so that is a challenge, find the connection and not actually...
Yeah, it's a challenge, but I mean, design for health, as I said, it has been grown up. We have seen that over the years. A lot is happening. I was raising my hand with healthcare professional like this because I went to medical school, so I'm coming from that field and combine it with technology and design. And I do agree that there's a lot going on, but a lot is about citizen participation. And one of the examples of Rúben, for example, is how can we empower citizens to really bring in their research questions? And there's really a lot that hasn't been answered yet. So they come there, they want their question asked, but there's no research being done. But they cannot be the ones who take the initiative to start this research.
Yeah.
So if we include it and if we have find ways to do so,
Okay.
I think if we research in 2 years and combine it with what is already out there, because of course we are aware of that, that would be great.
Would be great. Well, I wish you good luck. In December, you will actually already bring up something. That's what you said? December,
Yeah, that's identifying the research gaps and come up with a new proposal for research.
Well, good luck. And Rúben, also thank you for joining us today here live. Give them a hand. Thank you. Because it's time now for a little break, 10 minutes break. So grab a cup of coffee or some water, fill in the pool, because Marjolein also has a poll for you guys back home. And see you back around 12. Yes, welcome back to Drive Health. Actually, we started, or we ended the first half with a poll question, because we spoke about collaboration, how important it is to make the connection, and now we are in the COVID time period. So what was the poll about, Marjolein?
I asked the audience on Zoom, what do you experience? How does the Dutch corona lockdown, if we may call it that, influence your co-creation processes? And most of them say we continue with almost all of them, but it's not necessarily easy. But some people actually say it suits us.
It suits us?
Yes, we reach more people now because it takes less time. So I'm happy to hear that it's not a big issue for everyone.
No, actually, it's even positive.
Well, some also say like there is no co-creation anymore. So some people are less positive, but yeah, it's...
Okay. But the majority is actually positive about it.
It's okay.
Or they can continue co-creating. Okay, well, thank you for that. Because every day at Drive, we also work together with the embassies of the World Design Embassy. And of course, today it's the World Embassy of Health. And Pauline Melis, you are the curator of the Embassy of Health. Before I'm going to ask you what's up now in the embassy, so what do you think of that question of corona?
I think it proves that designers are resilient and still find ways of really tapping into the dialogue and staying in touch and being connected.
Yes, they are creative enough to find a way.
Definitely.
Yeah.
Yes.
So what can you tell us about the embassy? First of all, what is an Embassy of Health?
The Embassy of Health is our 4th year now, and we try to bridge the collaboration between healthcare and designers. And for us, it's really also to look at health in the larger setting as our health and not necessarily the healthcare system. And we try with this time, first year virtual exhibition, we try to inspire and show examples of designs of things that could happen, futures, but also to reflect on things that are really stressing, because this COVID has proven us to really reflect on our systems and how we want to go into the future and what decisions that need to be made. So we have some great journals with healthcare professionals. Look at all the projects, and some nice examples are shown. Two of them will be sitting at your table.
Exactly. I will talk with two of your representatives further on. But Bart was also mentioning that actually the main goal is to make that connection between those two worlds. Because how big or how large is the gap?
It depends on which point of view you take. What we see is that designers are really stepping up and really coming up with practical solutions, but also be critical about the system. So they really start to ignite a dialogue. For healthcare professionals, I think it's also providing time and open up their mindset, because everybody is really focused on providing good healthcare services, and it's for them it's really a new way of collaborating.
Yeah, it's also a new mind shift.
Definitely, and what you see is they're really into their own silos. Of course, everybody in their own profession is in their own silo, but bringing in different backgrounds like designers, they can really go through the whole system. They look at it in the overview.
The holistic approach, maybe.
Definitely, yes.
Well, Pauline, thank you very much for your start, because I would like to introduce my next two guests at the table, Inge Kruit and Levi van Dam. Yes, here at my table, Inge Kruit. You're from Druid. You're actually law specialist, a Templar, and a design student. And with us, with Zoom, Levi van Dam, also a designer, a researcher at the University of Amsterdam, but also working at Spirit, Jeugd en Gezin. So first, let me start with you, Levi, to hear what you're actually up to at the moment, if we talk about the Embassy of Health. What do you want to share with us?
First of all, thank you for having me. And I'm sorry I'm available this way. We are in quarantine since my stepdaughter, a girlfriend of her, was infected by corona. So that's why we have to do it virtual.
And how do you feel?
I'm okay. I'm great. Thanks.
Okay, great.
What I want to share is an experience we had last year in collaboration with Greenberry. We collaborated with experienced experts. These are youngsters working in youth care, but also they suffered mental health issues. And we worked with them on a project which is called the Expertise Centra. These are centers of expertise in the Netherlands. In the Netherlands, 1 out of 27 children used to have youth care in 2008, but this number has risen to 1 out of 8 in 2008. So it used to be 1 child in a classroom, but nowadays 3 children in each classroom receive youth care. And youth care is a form of social services that you can receive at home, for example, when parents suffer from a divorce, but also when a child has ideas of suicidal ideation, is involved in criminal activities. So it's a quite broad range, but last year's the number of youth receiving youth care services is risen, and that's a huge problem, because especially for the children who have really difficult problems, like suicidal ideation. They come and wait.
Do you understand? Okay, can you explain? Probably it's not your field of expertise, but why is it actually increasing so much?
We think that's more of a societal issue. If we look at the numbers and we look at, for example, the complexity of problems, then it's not necessarily that the problems are more complex now if we compare it to 10 years ago.
Yeah.
There has also been a huge shift in government. So it's not that the whole system has changed, and it's not that it's bad, it's not that it's helping, but it's also not that we think that there is another systemic change needed. So we think more that it's more of a societal issue that we as a society find it difficult when children have problems, or as a parent we suffer from problems in raising our children, and that it's difficult to talk with each other about these problems, and that we reach out to professional care instead of talking with a neighbor, of using Google, for example, to help you.
So what can actually design contribute to this problem then, to this problem of more and more vulnerable youth are actually asking for help?
Yeah, what we've experienced so far is that design is an excellent way to really understand the motives of youngsters, why they reach out to care, but also to understand the barriers which are there for them not to reach out to care. But what we've also seen, and that's especially in the project which we did with Greenberry last year, is that we also need to think of what does a designer need when they are confronted with these kinds of problems. For example, two colleagues of ours, Chris and Gabriela, interviewed a few youngsters. They experienced a lot of problems in the last 10 or 15 years, varying from eating disorder to suicidal ideation. And they had a whole day of interviews to come up with a customer journey. You're probably all familiar with that. And after this, they were exhausted because of all the interviews, of course, but also because of the stories they heard. And we had a chat afterwards, and they said, we are not used to these kind of stories. We are used to interviewing and hearing a lot of information in a small period of time. But these youngsters expressed to us that they wanted death, that they wanted to kill themselves, that they had ideas about how they can do it, and that until today they still sometimes have these periods of time that they feel that they shouldn't be alive anymore. Mm-hmm. So these are stories. As a professional, as a social worker, as a psychologist, I can't say that I'm used to it, but I've learned how to deal with it.
You're trained for that, but for designers, it's actually overwhelming.
Yes. So that's also a question we still do not have the answer on this, because how do you prepare social designers when they are confronted with these difficult issues?
Well, can you not implement that in the study of designers, in their education skills?
I think it should be part of it, especially when you're focusing on these kind of populations, that you should know how do you deal with the situation. We said, well, we can offer you some supervision, as therapists also receive, just to learn how do you cope with these stories, and what's your responsibility in listening to these stories. What do you do with it? With whom can you talk about these stories? Mm-hmm. But I think, it should be part of the education.
Yeah, because how do you make sure that you're not going to be a social worker, but you can still be a social designer?
Yeah. I think that should be the question for when you are educating this, because I do think that social designers are not social workers. But what we've heard now from these colleagues is that they can't sleep, literally. So that's difficult. And you have to learn how do you cope with these situations.
Yes, and so this is actually what's happening with the social designers, with their professional education. But are you still able to help those vulnerable people then, the youth that we're talking about?
Yes, we are, but that's also my second question, especially for the audience. What we've learned also in this project is that in the youth care, we work a lot with client participation. And it's mentioned in the presentations before also, the co-creation, make them participate in the projects, make them come up with their own solutions. But we also experience that this is really difficult sometimes because these are youngsters, they are 14, 15-year-old, and they suffer from real difficult mental health issues. And then you ask them to co-create. That's sometimes the question is too big.
Yeah. So what is then your question for the audience? What do you want to ask the people who are watching?
Well, I don't think we should talk about client participation because that's not enough. But maybe co-creation is too much of a question for these vulnerable people. So how do you give these people, these youngsters, a voice in the project of design, but also let them know it's not always their responsibility to come up with solutions.
Yeah.
And how do you make them a real participant of the process? And how do you share responsibility? But what's the responsibility of the designer? And what's the responsibility of these youngsters? And how do you do it in a political landscape?
Okay, I think it's a great question. Let's see, Marjolein will bring it up in the chat, and let's see if there are some suggestions. So we come back to you then, Levi, maybe with some great suggestions how to do that. Because here at my table as well, Inge Kruit, the other representative of the Embassy of Health. Welcome. You are a legal advisor, but also a student, social design. And based on your study assignment, you actually created the design session with water professionals and people from the healthcare to actually come up with a new design to change our healthcare system.
Yeah, that's right. Yeah, maybe we can take a look at the film first and then I explain all about it.
Let's take a look at your film.
De zorg in Nederland is goed, maar complex georganiseerd met veel bureaucratie. Juist als jurist voel ik me verantwoordelijk om die overregulering te veranderen. Via een uitstapje naar ecologische manieren van gezondheid organiseren kwam ik uit op het belang van water. Het perfecte rolmodel om de zorg beter te laten stromen. Maar voordat de zorg tussen mensen als water kan gaan stromen, moet het huidige regelsysteem op zijn kop. Anders stroomt er niks door al die schotten en hokjes in de zorg. Ik ontwerp daarom nu eerst een nieuw macromodel en nodigde daarvoor diverse experts uit de waterwereld en de zorgsector uit. En samen met designers hebben we een avond rond de tekentafel gestaan om te beoordelen of we van het watermanagement kunnen leren. Het antwoord is ja. Hoe? Ik citeer de deelnemers. De burger uit de regio betaalt voor de zorg uit de regio. De burger krijgt er zeggenschap voor terug, samen met andere stakeholders in een democratisch gekozen regionaal zorgbestuur. De regio's herverdelen het geld, dus voor de verzekeraars is geen rol meer. Het Rijk houdt alleen toezicht op het functioneren van het systeem. Inhoudelijk toezicht op de zorg vindt in of tussen de regio's plaats. Unaniem werd dit model kansrijk geacht, waardoor het verder uitgewerkt gaat worden met onder andere een financiële onderbouwing en vervolgontwerpen voor het microniveau. De zorg die als water tussen individuen gaat stromen.
Yeah, Inge, it's of course in Dutch, the film. So for our watchers abroad, they didn't really understand the film. So what is it actually about? Tell us a little bit shortly.
Yeah. What I'm doing is finding a solution for a long-felt problem in healthcare, and that is over-regulation. There are so many laws, so many rules, so many regulations, so many checklists. It drives patients and professionals crazy. And I, as a healthcare lawyer, I felt responsible for all those rules and regulations, and I wanted to help to find a solution. But within the current system, within the system of laws, I couldn't find a real solution. We could diminish some rules, but there will always come new rules. So I was looking for a different kind of solution. And the frame innovation, it's a creative method of solving complex problems by looking into different areas. And I was thinking, what area is dealing with similar problems, but solving it in a very different way.
Yeah.
And I came with the idea to look into ecology, because humans are not the only species that are optimizing their health. Other species in nature are also optimizing their health or their environment to stay healthy. And they don't use any rules or regulations whatsoever. That's only up to us humans. So I looked into how they organize health, and water was a very important part of that. And water itself became a role model for my design. Because water is able to adapt easily, and water is constantly in connection with its surroundings. So it was a really good role model for the health system. And when I was designing and drawing a new system that followed the guidelines of water, I was thinking, I don't have to design a new system. It already is here in the Netherlands.
Yes,
we are famous for water management.
Yes, our water boards, actually how they function,
Yeah.
that was for you a great example or an inspiration source.
Precisely. So I didn't have to invent. I only had to find a way to, together with all the experts we already have in water management and in healthcare management and in patients and professionals, how could we transfer the lessons learned from centuries of water management in the Dutch to the healthcare system? How can we use that knowledge and make it a system like the water management system? Because they don't use so many rules and regulations, and it's not so structured as the healthcare system is.
So you actually you came up with this stakeholder session to bring all the stakeholders together. What was their reaction?
At first they were surprised, but very early on they understood there could be a real chance that this would work, because water is also a very important topic in the Netherlands. We live below sea level. We have a lot of water by rivers and rains during some periods, and others not. And they managed it already for centuries with a great danger of making mistakes by which we all would be flooded. So they are so aware of risk management that they could feel a connection with the healthcare sector and vice versa.
Yeah, and did you also involve the patients in that session?
Yes. Aren't we all?
Yeah, we are all
patients sooner or later in our lives. So every human being can understand the position of a patient. And with the next sessions, it's only a first prototype, what I reached with all those people yet. In the next sessions, there will be more and more citizens, patients, professionals included and co-creating.
Yeah. Because it's really like a disruption or an interruption of the current system.
Yes.
Your proposal or your design. So how do you think will it really work, or is it just a study assignment?
Now the water management has already proved that it has worked and that it works for centuries. So I don't think the question is, will it work? The question is, do we trust healthcare experts and patient groups as much as we trust the water management experts? Because we trust them so much, we leave it up to them to keep us healthy and safe with dry feet. They can take responsibility and make it work in Netherlands. And when we give the same amount of trust to the healthcare patients and the healthcare professionals, I believe strongly that they can also make it work.
Make it work, yeah. And it's
without being controlled all the time or regulated in any way.
It's a great mind shift. It's absolutely an out-of-the-box design. So let's see first if there are any questions also to Inge. Are there questions, Marjolein, to Inge?
Well, I think there's someone who is saying like she finds it very interesting how you shift from the water to the healthcare, but isn't water a completely different subject? It's an object, although we know it has a voice since a few days.
Yes.
Is it? I mean, yeah. There's people and there's water. So.
Yeah. The importance of frame innovation is that the areas you look into doesn't have to be exactly the same. it's more about has it some similar problems or similarities otherwise you can learn from. And that is how I use the water. We can learn from how water works and how water is managed.
Yeah,
so it doesn't
take
have
it
to
too
be
literally.
No, not necessarily.
No, not necessarily. If people want to know more about this project or your design, where can they go to?
They can contact me because I would really love to have more people involved. Already there are a lot of healthcare institutions involved and the water management sector as well. But financial, patients group, policy, politics, they are more than welcome to join us in the next sessions to come.
Yeah, great. Well, good luck with that very inspiring idea and also very out of the box. Before we move on to our last topic, let's go to Levi, back to Levi again, because do we have any suggestions, Marjolein, from our viewers?
Actually, in the chat there were some suggestions from Adi Bax, and she has some suggestions for him, but they were in the chat and Levi has read them. It was about the Cultuurkantine in Breda, how they did it, and also an interesting project with the Blauwe Maan, Blue Moon. And I hope we'll get some more suggestions.
Yeah, because Levi, did you read the chat?
Yes, definitely. And I already looked at some suggestions, so thanks a lot for that.
Can you share some with us? Because I haven't read the chat, and also the people here at the FNR also not. So can you just tell us one or two suggestions that really work for you?
Well, there is an interesting suggestion from Breda, in which artists help young people with a vulnerability or another social background to express themselves. I only have read the website this far, so maybe the one who suggested it can explain it better.
Okay. So, but that's and what is the website address?
It's the Cultuurkantine.
Oh, that's the Cultuurkantine.nl. Yes. Okay. Well, wonderful. I hope we can save the chat because there are a lot of suggestions in the chat that might be interested also for people who are watching later on. So thanks, guys, for using the chat and bringing us your suggestions. And Levi van Dam and Inge Kruit, thank you very much for joining us at Drive 2020. Thank you. Yes, because we move on to our last theme of Drive Health today, and that is what will be happening in future research. Yes, the future. What knowledge will be developed and what knowledge do we need in order to design better and to make better designs? I'm going to talk about this topic with Valentijn Visch, Associate Professor from Delft University of Technology, and Sanne Kistemaker, Director Service Design Bureau Muzus. Yes, welcome, Associate Professor Valentijn and Sanne. Welcome in the show. Let me start with you, Associate Professor, because you started a new research from a big call, the transition and gedrag from the NWO. We heard it actually the last couple of days often, this big call. And in the next 4 years, you will work on enduring rewards, supporting lifestyle change maintenance by dynamic, personalized incentives. And going short, how do you keep people motivated?
Yeah. There are a lot of research since, I think, about 20 years about how to pick up new behavior and how to change or adapt to a new behavior, so how to withdraw from the bad behavior, for instance. But there's very little research on maintaining the good behavior. And that's exactly the gap that we want to fill, or you might say the next step. Because if you have a nice program, for instance, a smartwatch, counting all your steps, that might work and motivate you for about 3 months or perhaps 4 months, but after that, people drop out. So what can you do then? And that's, I think, an essential question when you're talking about health. Because health is not created in 3 months. Health is created in 20 years or a lifetime.
Yes.
So you have to do research together with, of course, with a lot of experts in psychology and clinical institutes in order to motivate people how to keep up their good work. And that's exactly that we will research as designers, how design can contribute to this.
Yes, so how can we keep up that good behavior or that good attitude that we have?
Yeah.
Because Sanne, you are the director of a service design bureau. You're actually working all the time with this kind of topics, don't you, in practice?
Yeah, we do. So I relate to all the topics here because we do design projects for social issues mainly, and we focus on intrinsic motivation. So to map all the whole context and all the different stakeholders. We focus on the.
You get a different microphone, I think.
Yeah.
Oh, no, Sven is running around. We continue later on, a few minutes, because I think this is actually also the right moment. We are living now in that COVID-19 time frame, where it's extremely difficult for people to actually behave in the right way and to consolidate our behavior. So is that also part of what you're doing now? Yeah, you got your own mic now?
Yeah, this is perfect. What we do is not only...
I think you have to be a little bit closer to the mic.
Yeah, or the mic closer to you.
Yeah. Is this better?
Yeah, you can also reach... Yeah, exactly.
Right.
Yeah.
So we are not only looking into consolidating the behavior, but we also, as a design agency, we try to make the future scenarios more tangible for people in order to have the conversation about it. So, for example, here at the background you see a simulator for informal care we designed. So everyone wants to become old, but no one wants to be old. So to have the conversation about it, it's very difficult and it's very... people don't like it that much. So by building this simulator together with a theater group, the Kwekerij, we made it more tangible for people also in order to be able to speak about it. And then you can have that conversation and see what people need in the future also to change their behavior. So, for example, become aware of what you want with informal care, or what kind of actions do you need to undertake if you want to create it as you want in the future.
So you have to create a dialogue around it. Is that a main tool you use?
Yeah, that's actually in all the steps in our design process. It's always about dialogue. So we want people to become aware, and only if you are aware you talk about it. Only if you talk about it you take actions. So what we want to prevent is that situations become too urgent and you don't have time or money or maybe even options to choose from. So so we are focusing mainly on the future scenarios and also the prevention part of care.
Because then you have time, but I can also imagine that there are situations that you don't have enough time to create a dialogue, but that you have to run to actions or something like that. Is it also part of your research?
Yeah, I have also another project running, Healthy Storytelling it's called, and that's oriented to use storytelling as a motivator for people to create dialogues about difficult projects or difficult subjects. For instance, like elderly, but also like stigmatized problems like obesity or discrimination, things that people don't like to talk about, and you have to open up people and create a kind of dialogue. And I think that's the first step for creating an awareness. And an awareness is then the first step in order to create an intention for people to change their behavior. But then comes a third step, you might say, in executing the behavior and maintaining it. And I think in the end, and that's also the question perhaps for Sanne, if you create this dialogue about your future elderly age, that's good, of course, but will it affect in 50 years, your experience, for instance, as an elderly person? I think that's also a question to be solved.
Yeah, and asking the questions, answering the question?
One of the things I would say is that in the first we talk about co-creation this whole morning, and I think co-creation should only be, I think, a small step in the whole process. And you have to be very precise when you want the meaning and the co-creation motivation of your clients or of your participants, because it's needed in the beginning, of course, to make sure that the problem you are addressing is a problem that's recognized. It might also be helpful in the middle stage of a behavioral change, so that all the incentives that you create or the motivators relate to the personal motivations of the users. But at the end, I think the users should create their own experience, more to say. So you should step back as the designer.
Okay, they have to create their own, what did you say? They have to create
their own motivation. They create their own behavior.
Yeah. So that's the last step then. That's really about consolidation. So it starts with the stories, then with the incentives, but then, and that's
I think you start with helping. So, and helping might be also by rules, but also by financial incentives. Then you have a period in which you co-create together with the rules and the incentives and the users. And after, in the third period, that's the consolidation of the behavior. People just do what they do because they are intrinsically motivated or getting used to this kind of
And
behavior. How
can design contribute to that last part then?
Yeah, well, that's the topic of this new research. One of the things that we are thinking about is to deliberately give freedom to the user in order to create their own motivations. So you can motivate people, for instance, with financial incentives always. But at the end, people get used to it, and in the end, perhaps people are more motivated after 10 years by feeling fit, or sleeping well, or having a good social life, or being having still a good family when they're old and not arguing all the time. These kind of things, they are so personal that you can help them. That you can help create them as designer, but in the end, it's totally due to the participant.
Yeah. Okay. So is it also part of your approach, that last phase actually about consolidation?
Yes. Well, some projects are not that far yet, but if I can give an example, we designed conversation tools for families to talk about informal care and the future. And what we did is we gave them the tool, and then we asked them to make a video of the conversation, and then we interviewed them a few months later to see what kind of actions they took together as a family. And that was very interesting, actually related to this topic, to see what they did. And they all took different actions. For example, finding out all the options at the municipality, whether they could change their house or make a plan for maintenance of the house, or see if they could move, for example. But having this conversation is the start, actually, and also defining your question, because I think, we say help, or we say people come with a question, but often people don't realize what their question is. And we also see that with all the municipalities we work for, that they offer services that are actually focused on people knowing what they want or knowing what they need. And I think that's a big misunderstanding in the whole topic of health, is that most people need help actually formulating that question.
Yeah, so there is a service, but they don't really feel that service is for them, or that service is solving their problems.
Yes, exactly.
So you have to change.
Yeah. And you, as a designer, we can play a big role in that also.
I see Marjolein.
Yes, because actually we have a question from Nico van Meteren, who is from a top sector, life science and health. And I'm not sure if he wants to join us himself, so I'll just ask the question for him. It is known that most of our behavior is completely unaware behavior. So why do we still adhere to the theorema that changes of behavior off from awareness? So I think that's.
So how do we deal with unawareness or unconscious behavior?
Yeah, I think that's also what we research in the research phase of our design processes. So we use research techniques that actually focus on the latent needs. So most people are unaware of what they want differently in the future, or what kind of things they find really important. So most people don't know their intrinsic motivation, especially if you talk about topics like retirement, which are really abstract, for example. So that's actually what we focus on, to get that onto the surface, and to see if we can find patterns in that, and to see if we can find different groups in that, and then design for these needs, so the future needs.
Yeah, and how do you incorporate that in your research?
Yeah, it's a good question, of course, that a lot of behavior is unaware, but sometimes it's important to make it first aware in order to change to a good direction. For instance, if you are not aware that you are eating too much cheese in the evening, you might create a kind of design that makes you aware of eating this cheese and that it is unhealthy. And if you stop eating it or reduce it, that you might have a better experienced life. Or more
because is that also the way we have to solve the COVID problem now? A lot of people are not aware that they, with their behavior, are forming a risk. Younger people, or so is that also that we have to start a dialogue first?
It definitely helps. I think it's one of the factors. What is your role in the total the total people of the Netherlands? So if you are, for instance, not ill and you don't know anybody who went ill,
yes.
Why would you adhere to these rules? And you can make people aware of the risks, of course, and also of the deaths and also of the illness, and that will help. But it's not the only thing. I think a lot of things don't start with awareness. You can also just ask people to behave in a certain way, and then they will start, for instance, changing their greeting procedure by not shaking hands but elbow. And it has nothing to do with awareness so much. It's just another kind of greeting.
Yeah.
And after a while, people can become aware that due to their changed behavior, their
attitude or the way they think also had changed.
Yeah.
So it starts with behavior, and then the next.
And then
step.
awareness can come. But awareness always have a role, I think, in behavioral change. But at which position, if it is a bit in the start or in the middle, it depends on the problem that you are addressing.
Yeah. Because what would be your suggestion now in this time frame? What can we actually do to make people more aware, but also more willing to follow the rules?
Well, I think to start with, you really need to understand why people are following rules or aren't. So I think you really need to understand the intrinsic motivation to see why it works. And another suggestion, I think, it's also quite unclear what are the measures, what are the rules now. So if you look at the journey map they made, the government, for the rules, I think it's really unclear and everything is in text. I think they should really have hired a designer to design that. And there are good examples in other countries, working with icons, for example. So 1 out of 10 people in the Netherlands is low literacy. So why are we, trying to deal with so much text, for example?
Yeah. So we have to make the rules more clear, but do we also have to envision the future more? Where are we going to as a society?
Yeah, I think...
Why are we doing this, actually?
Yeah, I think now there's also a lack of perspective. And from all the projects we do, I think that's a really important part, to see what goal are they working towards. And this goal might be different for different people, but you need to set a goal in order to know where you're going to. So why are you following a certain process or certain steps? Where is it leading you to?
Yeah, where does it bring you to?
Yeah.
Another questions, Marjolein?
Yes, I think we have a question again from Muka.
We have him live in the show?
Zoom.
Oh, there you are again. Hi. Welcome.
Woo. We have a little bit of a sound feedback loop.
Okay, try to ask your question. We'll see how it works out.
Yes, I was curious.
No.
Wij moeten de oogjes in doen.
Okay, I think I'll ask the question then.
Yes, you ask the question. You know the question? Yeah.
Yes, I do. Muka is, if I may say Muka, I'm sorry. He is curious if we should change our way of doing research in the future to create a great impact, or will the current research and design tools still be okay?
So do we have to change the research methods?
And do you, the speakers, have suggestions for us as researchers and designers for new tools and new research?
Yeah, research is always evolving, and changing. So, for instance, this discussion that we had about citizen science and also co-creation, I think it's very important to first understand them, what is their value, and also then understand when they are needed, when they are beneficial and when not. And these kind of things are, I think, important and rising.
Because are you actually rooted enough in society as a researcher?
I think we are, especially as industrial designers, because we are trained in that. But you can see in other disciplines, sometimes in healthcare and psychology and other scientific disciplines, that the idea that there's a lot of knowledge already in the society and in the participants is now also growing. So
that's a topic of Sabine. So how can we involve the citizens?
But sometimes it's difficult. I don't know if you study mathematics or theoretical mathematics. I mean, what can you do with participatory design? I don't know. That's more difficult, of course, than if you address societal issues as a designer. So I think in design research, these co-creation methods are far more used than in other disciplines. And you see it now more and more be used in healthcare. I think you can also address that and in other societal issues.
Yeah, and I think also it already changed a lot over the last couple of years. So from the point of view that research needs to be validating and based on facts and everything, we shifted to explorative research and the dialogue with users and also using it as inspiration. But for me personally and my design agency, we changed a lot in our methods because everything is digital now. And we still try to reach the empathic research level. So we, for example, ask people to make vlogs. We ask them digital questions. We used WhatsApp a lot with youngsters. We let children, for example, make a video of their own morning ritual, for example, and eating habits and stuff like that. So,
they can really participate by their own devices, their own medium.
Yeah, definitely, and a medium that they feel comfortable with also. So, and we're going to stay using this in the future because it really brings a different perspective on the whole context part, because normally we would do an in-depth interview with the best way we could, but seeing it from their point of view, it also it's a whole different world.
Well, it is about health today, and we are in the middle of a huge health crisis, of course, in this time frame. So my last question actually is, if there's no urgent question from our Zoomers or from our audience, there is one, then I will finish with my question. Sabine, Sven is coming with the microphone. There it comes.
Well, this is more in addition to what has been said at the table as well. At University Twente in the TopFit Citizen Lab, we have a researcher who looks only into what kind of methods and methodologies are being used for citizen science for health. So that was also the question that being asked, do we need to go to different type of research? In a way we do. So I think looking into these methods, what is already out there, but how do we build upon it is quite important. And maybe to add to that, if people are interested, on the 20th of November, there's also a conference online at University Twente, it's shared in the chat. And that's something to discuss further. How do we take this next step to this type of research as well?
Okay, great. Well, thank you for adding this. And Marjolein?
Yes, there was a question about, let me just grab it here, from Ida from the TU of Eindhoven. I was wondering what the role of the environment is in designing for behavior change. From what I gather from the discussion so far, it's very personal oriented.
The role of environment.
Yeah, it's extremely important, I would say. And we say that, for instance, in personalized design, that you try to adapt your intervention or your design as much as possible to the motivation and the personality of the user. But part of this motivation of the user is also his or her environment, and that's the building environment, the working environment, but above all the social environment, so the friends and family. And we want to incorporate, I think, them at least in the co-creation process, but also in the intervention process. I mean, if you can be motivated by your spouses or your family, it's much better than if you are motivated by a tool or by some
So your environment is extremely important. Maybe it's also nice for our viewers back home to watch the video of Pride and Prejudice. It's also a great video with the macro elements in it. Environment?
Yeah, I think I can only add to what Valentijn said. It's really important, and I heard the term personas, and I think we should also, in some cases, talk about socionas. So the whole
socionas,
the whole social environment, and actually all the different triggers that you encounter as a person.
Yeah. Okay, well, we have to come to a closure. So my last question for you is actually if our minister, Hugo de Jonge, calls you tomorrow because he needs some help in this crazy time frame, what would be your first suggestion towards him? How can he actually deal, or how can we deal as a society with this health crisis that we are in?
I think what you see now is the corona started more or less half a year ago. That's also the Enduring Rewards time span of half a year of behavioral change. And you see that people already change their behavior in, for instance, the greeting and the 1.5 distant meter. And that works quite good. But I think since the rules are always changing, it would be good to stabilize the rules, but also to compensate them with the kind of freedom. So make people aware or provide freedom to them in which they can compensate their loss of freedom when following the rules.
So you need a kind of reward system.
Yeah, this freedom might be, for instance, in the working hours, for instance. You can make people aware of the freedom that they have during Corona, because people can experience freedom, for instance, in their time management. But you can also explicitly provide them with freedom with financial bonuses or free tickets to cultural events, things like that. So some kind of compensation to the following of rules. And I think that will really work.
Okay, great. Well, a suggestion. Do you also have a suggestion?
Yeah, I think I already said it, but I would first talk to people and see why are they following or not following the rules. I think for many people it's very intangible, so they don't see what's happening and they don't see the effect of their behavior. So I think that would be one of the challenges I would like to deal with as a designer. And I would really suggest to hire a designer to redesign the journey map they provided.
The road map, redesign it with a real good social designer. Well, thank you very much, Valentijn, Visch and Sanne, Kistemaker, for your point of view. Thank you very much.
Okay.
Yes, because we are actually reaching the last phase of this broadcasting. This is the last one, the Design, Research and Innovation Festival. So thank you very much for joining us the whole week. Thank you, all the people here in the Effenaar. Thank you also the technical staff for making this possible. Thank you back home for watching us. Don't forget to fill in the poll, because we would like to know what you're going to remember. And of course, in the meantime, visit ClickNL and Design United. We hope to see you back next year for Drive 2021. And in the meantime, stay safe, stay healthy, and stay inspired. Thank you very much. Bye-bye.